All right, well, I have 6:30, so we'll get started. Happy to be here with you all tonight. My name is Dr. Audra Cave. I'm the department chair for the F&P department here at Frontier Nursing University. And I'm going to share some slides with you and talk to you about our program. Um, we'll go through our program and then we'll have some time for question and answer at the end. I'm joined by a couple of other Frontier facilitators, so I'm going to have them introduce themselves and let you know what they'll be talking about this evening. So we'll start with clinical advising.
Hi, everyone. Thanks for joining us. My name is Sarah Johansson. I am one of the clinical advisors here at Frontier Nursing University, and we will talk a little bit more about what my department does later on in the presentation.
Thank you. And then admissions. I believe we have someone from admissions.
Yes, hello. My name is Richard. I'm here on behalf of the missions team, and I'll be helping out on the chat and assisting with the admissions questions as well.
All right. Well, thank you, Richard and Sarah, for being with us tonight. So let's get started. Well, I thought I was going to get started. There we go. So again, this is me. I'm Dr. Audra Cave. I'm the department chair for the F&P department here at Frontier Nursing University. I've been faculty for Frontier for about 15 years, worked in many different capacities with the university, but I've been the department chair for going on almost 2 years now. Um, I got my MSN at F&P through Frontier many moons ago, and also the DNP, Doctorate of Nursing Practice from Frontier. So I've been around for a little while. Here in this slide, where you're looking at a group of students who are on campus. Um, we'll talk about the purpose of the F&P department is really to prepare students to work with patients and families on a continuum of family practice care. We're community-based, so this is community-based family practice. And one of our focuses, you'll hear this a lot with Frontier, we really focus on rural and underserved populations. So our purpose is to prepare our students to excel in those arenas, providing across the lifespan care to patients in their communities. In this picture, this is our campus, and these students are standing around a big fire pit. Students come on campus twice during their time in the F&P department, and we'll talk about those a little bit more, but this is a group of students who's come back. And it looks like it's chilly and rainy outside. Frontier has been around for a while. We've been doing distance learning for a while. I believe we started with the distance learning back in 1989. So we've done it. It's changed throughout the years and it's a little different than it was back in 1989, but we still um, really grew up doing this distance learning, learning in your community model of education. One of the things that you'll come to hear frequently when you think of Frontier, when we talk about Frontier, is our culture of caring. The culture of caring is a framework that we use that helps us in our interactions with everyone. So it helps us remain engaged and respectful and appropriate with each other in this professional setting. It can be difficult when you're online and you're not in person with each other, but the culture of caring helps guide us into maintaining that caring, just treating each other with respect and dignity. Everybody has value and everybody has a place. You will do your work at home in your community. So your community is your classroom. You will come to campus twice. We have two. One is an orientation session that's about 3 days long, where you come on campus and you get to know us a little bit better. We'll share more details with you about your program of study, give you an idea of what to expect. Then you'll go back to your community. You will do your coursework in your community, 100% of it. And then you'll come back to campus for about 5 days, and we'll do sort of a clinical immersion experience where you practice with skills and you practice with standardized patients just before you go into your clinical practicum. And you can see we have two students here who are in one of our classrooms, enjoying being together and learning as opposed to being in their community. Some of our achievements, we have been teaching midwives and practicing family care for over 100 years. Students and alumni are in every state. We have 2,700 currently enrolled students now. About 550 to 560 of those are in the F&P department, and we have over 10,000 graduates. We just recently celebrated our commencement in September, and you can see here's some students who are enjoying that as they're getting ready for their commencement. Some other achievements, Frontier has been recognized for several years now as one of the great colleges to work for. We received that again in 2025. We have received the HEED, H-E-E-D award for being a national leader in diversity, equity, and inclusion. So that's the Higher Education Excellence in Diversity Award. The American Association of Colleges of Nurses recognized Frontier in 2023, again for our inclusive excellence, belonging, and sustainability in nursing education. That really does reflect back to our culture of caring. In 2024, Sigma Theta Tau, the International Honor Society for Nursing, recognized Frontier as a healthy work environment. So we're proud of all of those achievements, but really this is the achievement that just means so much to all of us, and that's when you successfully cross that stage as family nurse practitioners. Frontier had the first family nurse practitioner in the country in 1970, so we've been doing this for over 50 years. Celebrated our 50th anniversary in 2020. Our F&P graduates have a very good pass rate. Average is 96%. So when you look at statistics, when you're looking nationwide, the Frontier certification exam pass rate is much higher than national. National is going to be around the low 80s. So that's something that we're very proud of. And in this picture here, you can see we've got a graduate up front. That's me standing behind her. The clinical director is to the left. That's Dr. Nancy Pesta-Walsh. And to the right is Dr. Diane John. She just recently retired, but she was one of our longtime, very beloved faculty members. So how do we do this? Well, the academics and the pass rate sort of speak for themselves. But it takes more than that. It takes student support. It takes everybody working together, being a team. So we recognize that the student support is an incredibly important part of your success and ours. For your clinical practicum, we have clinical faculty who are designated in regions, sort of like experts in their region that can help you with the healthcare of the region, can help you with preceptors and just really knowing the nuances of where you are. We have academic advisors and clinical advisors. You'll hear from Sarah here in a few minutes. She'll tell you about her role in helping students prepare for clinical. But our academic advisors help students while they're going through the program. So they may help you with registration. They may help you navigate some of the nuances of being a distance learner. They're there to help you really with celebrate success and overcome challenges. We do have online student mentoring groups. We have a fabulous online library, financial aid scholarships, and then we have about 10 to 12 student interest groups. So that's an opportunity for you to engage with other students outside of the classroom and things that might be of interest to you. So several of those student interest groups that you could participate in. Another student support is financial. So we offer scholarships twice a year, in the fall and in the spring. And I love this slide here where it shows that in 2024, we were able to offer $1.7 million in scholarships to our students. That is a direct reflection of our success and our generous donors. You do have to meet certain requirements to qualify for a scholarship, including completing 24 credits earned with Frontier with a minimum GPA of 3.25 or higher. The scholarships vary in amount, but we have several, and we're very proud of that. All right, Miss Sarah.
Hi, everyone. So our university has a long-standing tradition of empowering students to secure their own clinical sites, often within their own communities. However, you'll have many different resources at your disposal to support and assist you with that search. The first being our community map, which currently has over 20,000 sites and preceptors throughout the country. And these are ones that we have relationships with. Since this is proprietary information, you'll have access to this once you start your first term. And keep in mind, you aren't limited to just the sites and preceptors on the map. Additionally, my team is here to help provide assistance and additional resources for your search. You'll be assigned your own dedicated clinical advisor and regional faculty member who will specialize in your region and will be there to support you throughout your journey. If you have any questions, please let us know. I'm also going to put our clinical advising email in the chat just in case you have any questions after the session. Thank you all.
Thank you. Here's some of the faces that you will see. So up at the top, in the pink, that's me. Just below that is Dr. Nancy Pesta Walsh. She is the clinical director, so she is the academic in charge for making sure that your clinical practicum is robust and that you get what you need as far as experience. And then along the bottom there, you see various different folks. We have regional coordinators and clinical faculty who run those academic courses. We've talked about the regional clinical faculty a little bit. This is a faculty person who is dedicated to clinical. So in some programs, you'll have faculty that kind of split that role. They'll be in a course along with the clinical. Frontier does that a little bit differently, and we do our didactic work, your book work first, and then you go into clinical. So you have faculty that are dedicated to that. Your academic and clinical advisor, you'll be assigned a financial aid officer and a credentialing coordinator once you become a student. We offer 3 degree options, and that's the MSN level, the master's in nursing level, the postgraduate certificate. That is a person who already has a master's degree and is coming back for a second certificate, or the Doctor of Nursing Practice degree. Within the MSN, we offer all of these specialties that you see listed here. We have family nurse practitioner, have women's health nurse care practitioner, nurse midwifery, and psychiatric mental health nurse practitioner. We offer all of those as specialties that you can become certified. So here's sort of a visual of the journey that we've been talking about up to this point. You'll begin up here with the Frontier Bound orientation. That's that 3-day session on campus where you're getting to know us and we're getting to know you, and we're talking about the courses and giving you a nice overview. Then you'll return to your community to do your coursework. Moving on down the line, you'll return back to campus to do what we call clinical bound. That's a 5-day clinical immersion where you're practicing skills and you're working with simulations and standardized patients to put all of those skills together. You'll return to your community to do your clinical practicum. We do require 750 hours. You'll then be ready to take a comprehensive exam, which is really just an exam for the entirety of the program where we bring everything all back together to get you well prepared for that certification exam. Once you have completed the comprehensive exam for Frontier, then you are eligible for the degree conferral. So that's when we consider you a graduate. Any questions about any that we've talked about so far? Okay. And here's the time frame. This is generally the time that it takes students to go through the program. To begin with, we operate on a term system. So we have 4 terms per year. They're 11-week terms with the 2-week break in between. So for an MSN student, you can plan to be in school for 2 to 3 years, depending on your schedule and how quickly you can go through the program. If you're a postgraduate certificate student, then that's about a year to a year and a half. And our DNP program is 18 months. We operate on a rolling admissions cycle. So that means that we accept applications all throughout the year. And it's a quicker turnaround time for decisions. So once we receive the application, it starts to go through the process, and typically applicants will receive an answer in about 4 to 5 weeks. So now I will turn it over to Richard to talk about our admissions process.
Yes, hello again. So in relation to applying, there is, well, the application and then documents that students submit for review comprise of an essay, a current resume, all official transcripts for all completed nursing degrees. And then for students that hold an associate's degree and then an associate's degree in nursing and a bachelor's degree in a different discipline, there's another pathway to apply. It's via the portfolio instructions or options pathway. It just includes an additional essay, and I'll put that in the chat box as well. These steps to apply. And then the actual criteria. So students do need to have a current active RN license, United States, unencumbered, GPA, the minimum's a 3.0 cumulative on the highest level of completed nursing degree. And for the BSN, that would require or for the MSN program, that would require having a bachelor's degree, having that 1 year of RN experience. And then again, there's that portfolio instructions that I'll post for the other applicants that have an associate's degree, bachelor's degree in a different discipline. And then for the postgraduate certificate students, all criteria stands true, except PGC students do need to have a master's degree or higher in nursing, an advanced practice registered nurse specialty.
Thank you.
Yep, you're welcome. And then these would be in relation to the postgraduate certificate admissions requirements. Advanced practice registered nurses applying to the PGC, they would need to have a degree in one of those specialties that listed on the slide there. And again, I'll post this in the chat as well.
Thank you.
Mm-hmm. And then of course the terms here with the deadline. So right now at this point, if it's of an interest, applications are being taken for the spring term. The application deadline is January 7th, and that does incorporate all those documents aforementioned in the previous slide to have those in by the very latest January 7th for that deadline date. And then the spring term does begin for admitted applicants on April 6th of 2026. And the other term coming up is the summer term. So if that's of an interest, that application, just to be mindful, that won't open up officially till January 8th of next year. And then the application deadline for summer is April 1st, and then summer applicants begin coursework July 6th of next year for admitted students. And then the tuition, the current cost per credit are $705 for this program. Sorry about that.
That's okay. Thank you for all of that.
Yes, you're quite welcome.
All right, so a little bit more about the clinical experience. For MSN and PGC students, that's 750 clinical hours with a minimum there of 16 weeks of clinical experience or 14 weeks for PGC students. That just really gives you enough time to go through the program and really assimilate everything that you need to in the program. So you can do that. You can do 40 hours a week in clinical if you want to, but you could not do more than that. The clinical requirements are competency based, and what that means is we don't just want hours, we also want you to get a certain number of visits. And once, if you do apply to the school, you'll have access to a list of what those visits are. But they're adult visits, pediatric visits, women's health visits, newborn visits, what you would expect for across the lifespan F&P program. So they are both hours and competency based. And here are some pictures of our campus in Versailles, Kentucky. So if we go to the top left, that is a picture of our cafeteria. Right next to that, the two-story building there is a picture of it's called the President's House. And it's sort of like a event space for us. So that's right sort of in the middle of campus. Right next to that is the Welcome Center. That's the first building that students will come to so that they can get their initial supplies and get welcomed to the campus. Then back down below where you see the trees, that's a sort of a wide shot of the student lodges. We have 3 student lodges on campus that hold several students. They're 2 to 3 stories and have kitchens and living areas and all the comforts of home. Then in the center, we have another picture of our cafeteria. You can tell that we like food and we like our cafeteria. So that's another picture of that. And then right beside that is the sign as you're turning into the campus for Frontier Nursing University. It's a beautiful campus. It's quiet and peaceful. And I enjoy being there. I know students enjoy being there. There's fire pits all throughout. There's a walking trail. For it to be small and quaint, it offers quite a bit. All right, so life as an FNP. I can tell you that working as a family nurse practitioner, it really is the natural progression for me from being a registered nurse. What I liked the most about being a registered nurse, one of the things I really liked was the relationship that you can make with your patients and the difference that you can make with patients. That just goes to the next level when you're a F&P provider for your patients. Oftentimes, the nurse is the first one to walk in a room and know if something is going well or not going well, and that is because of our nursing skills. So it just moves beyond that. I like F&P because it's very broad. You can do a lot with an F&P rather than focusing in on a limited population. I like having the options that the F&P provides. Any questions? Anybody have any questions about, or maybe want to share why you're considering F&P? I think so many times we see the inequities or the inefficiencies of the healthcare system. And I think nurses are in a good position to help try to mitigate those. So I think a lot of times when I'm talking to patients, students one-on-one, that's sort of where the conversation goes with that we've been in nursing long enough to see where maybe we can help fix some of the problems with our healthcare system. And here's another picture of commencement. This is one of our faculty, Dr. Fuller, pinning one of our students. And a quote that we like to refer to is that success doesn't come to you, you have to go for it. That is certainly the flavor of the day when you're at commencement, celebrating everybody's success. We do have a team of professionals that are ready to help you and bring you forward to this next step. We've got some email addresses there. There's the FNU admissions, the clinical advising group if you have any questions about clinical, and then the financial aid. Another picture there with our resilience. I think that with nursing, you do have to have adaptation and resilience. So the definition here is adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. I think we all personify that in our nursing role. And that brings us to the end of this presentation. So I'll stop sharing. I want to take a quick look at the chat. All right. Any questions that we can answer before we close for the evening?
I have a question for you. Can you hear me okay?
I can, yes.
Thanks so much. So if you were to try to establish a new clinical instructor that you all haven't worked with prior, what does that process look like? How time consuming is it for the student and for the practitioner? I'm sure there's credentialing and paperwork. I don't know how much lead time they would need to become your clinical instructor. What does that
Mhm.
process look like?
I would plan on 6 months. It's not difficult. It's I think 6 months just gives you plenty of cushion. We have the community map and we have the resources that we have, but many students don't, they choose to go with a clinical site that is not a part of our clinical map. So I'm going to say that it's fairly seamless and we can get it done within 6 months. And I'm going to ask Sarah if she has anything to add to that because that's what she does every day.
Yeah, I think that's great. The only thing I would add is, we like Dr. Cave said, we try to keep it pretty painless. So it's usually just a matter of a standard contract. We'll have the practice to sign. As far as preceptors go, we just send them an electronic preceptor profile to fill out. But you won't have to worry about any of that as a student. Once you get your yes and you submit everything, our credentialing team will be hard at work taking care of that, all the legal piece. So, yeah.
All right.
And then, sorry, just a quick follow-up question. So I know you said I believe the list of preceptors isn't available until you're in coursework. And I live in rural Colorado as part of the reason why I'm asking. So I'm wondering if it's possible to see those options ahead of time in order to decide if I would need to try to add a new provider.
You'll be able to see them at Frontier Bound. I know for sure you won't have full access till you start your first term, but once you come to campus and you're admitted and everything, you'll be able to see it earlier. I'm not sure, Dr. Cave, anything else to add to that? I mean, we've got lots of different sites that we work with, but
Right.
I shouldn't, it's no problem to add them.
Rebecca,
Okay.
if you want to email me, so it's audra.cave@frontier.edu. If you want to email me, you can let me know what site you're looking for, and I can let you know if it's on the map. Will that help?
Yeah, that'd be great. Thank you so
Okay,
much. I will. I'll send you an email.
absolutely. Thank you, Ava.
I have a quick question here. So in terms of for clinicals, what you guys are talking about is you have your set, because calling from Oregon, Portland,
Mhm.
Oregon. And so if I know a family nurse practitioner, I could potentially set it up to have them as is that what we're talking about here?
Yeah, you sure could.
Okay, okay,
Yep.
okay. And that can be, and that takes about 6 months to set that up, but that can be set up during while you're doing the class part of it, right?
Exactly.
Oh, okay.
Exactly.
Okay, all righty, thank you.
You're welcome.
Uh,
Deborah, I see your hand up, and then we'll look at some of the questions in the chat box.
Great. Hi, thanks. My question has to do with the balance of doing a clinical experience with doing full-time work that I currently have. And I know that you said that the clinical experience will take a minimum of 16 weeks, and that's assuming you're doing the maximum number of hours per week. But my question is more the opposite, is considering the fact that I'm already working 40 hours a week, what is the minimum number of hours per week that I need to put in to the clinical that could work?
Right. That's an excellent question. It is tough when you're working full time. That can be a challenge. So I'm glad you're asking about it now because you can think about it. You know, you've got plenty of time to think about it and plan for it. We have 3 clinical courses. Um, the highest minimum for those 3 courses, I'm going to say, is 28 to 30 hours. So there is one clinical course where you're going to have to go at least 30 hours a week, maybe 28. And that's so that you can finish your hours within the course that you register for them. There's a clinical course where the minimum is 20 hours, and then I think the other one is about 24. So generally somewhere within that range.
Mhm. Okay, so it sounds like, I mean, do people that work full time typically take time off work, or how do people
They
typically
might.
do
They
that?
might take time off from work. Sometimes they'll bank vacation.
Mhm.
Sometimes they'll take a leave of absence from work. Um,
Mhm.
it just depends on how that works for really the student, like what they can do. Sometimes, like we do allow urgent care for a piece of it. So sometimes you can flex with your clinics. If there's an urgent care and you can get some hours on the weekend, some students will do that. But really, I wouldn't bank on that because we're community-based primary care. So generally speaking, your clinical sites are going to be Monday through Friday, 8 to 5 for the
Mhm.
most part. So it's really finding what helps balance through that. Um, I wish there was a better answer for you. I know it's a challenge,
Mhm.
but we work hard with our students and you know, the planning is the best thing, right? Planning and getting ready for it is the best thing. Um,
Mhm.
we're much more successful when we give ourselves plenty of time to plan for it.
Okay,
Um,
thank you.
You're welcome.
I had a quick question here. For the FMP, then I'm kind of similar to that in regards just trying to see if it's even going to be possible, you know, with my time.
Mhm.
So the 3 years is the longest you can take to do this.
No, we have students that take longer.
Okay, okay, because I would
So,
probably have to try to figure out a way, but to figure that out, you know,
right.
during the week.
Once you come to Frontier Bound and you commit to, you know, the program, you have the opportunity to sign up for either what would be considered a full-time track,
Hmm,
which is
hmm.
about 2 courses per term, or a part-time track, which is 1 course a term. So that slower track, you could take more than 3 years to finish that.
Okay, okay, all right, thank you.
And we have students who do that. So, looking at the chat, we've got a question from Angelica. She says, knowing that the F&P program is highly competitive, apart from the requirements for admission, what are you majorly looking for from applicants? Well, we'd like to have applicants who have the same values that we do. So, rural healthcare, underserved populations, wanting to take care of people across the lifespan. Those are some things that will stand out in admission essays. We're looking for students who, you know, maybe aren't the conventional students. We're adult learners. We're committed to learning. Students who will reach out to us when they need help. Students who will partner with us to complete this journey together. I think that's the best answer I can give for you right now, Angelica, but I love your question. And Anna, I see your hand up. I'm going to go through another question in the chat and then I'll get right over to you. Oh, wait a minute. Looks like Richard might have answered Carissa's question. Okay, very good. And then Anna, what is your question?
So I want to quickly follow up on the question that was just asked between the full track and the part-time track. So what if you decide to do one, like this quarter you want to do full-time and then the next quarter you want to do part-time? Can you go between the two?
As it currently stands now, yes, you can. I don't anticipate any changes with that, but I always like to preface it with what we're currently doing. So yes, currently students can start off maybe in the part-time track, taking one course per term, and let's say the summer rolls around and your work schedule maybe isn't quite as intense. You think you want to do 2 courses that term, you can certainly do that. The opposite also holds true. If you start in 2 courses a term, summer rolls around and your kids are home from school and you have less time for school, then you can back down to 1 course for that term. So yes, we do offer a good bit of flexibility to meet your needs.
And then just to quickly also follow up on one more question. So what if I start with 2 courses thinking that I can handle it, and then those 2 courses are just requiring a lot more time than I anticipated, and within a week or 2 weeks into it, I realized that 2 courses is just too much for me to do. I need to drop one. Is that also a possibility? And what does that mean?
Yes.
Would you be able, but you also don't want to lose your obviously
Right.
finances, right? So is that possible
Right.
to do?
Well, we have an add drop period, so you can make changes to your term during that add drop period. And that's generally about a week. So I tell students, when you get in the courses and you start looking at your syllabi and your assignments, map them out on your calendar. Take a look at other important things on your calendar. What birthdays are coming up? What important things can you miss or not miss? And take a good hard look at that. And if you think that you might need a little extra time for non-school related things, then it's better to drop the course than regret not dropping the course. So it really just takes a little bit of pre-planning, a little bit of looking ahead, talking to your advisor, particularly your academic advisor, getting, some input from some other folks. And then, yes, if you wanted to drop the course, you could drop the course during add drop with no penalty. After add drop, you can still withdraw from courses. It gets a little bit more complicated, and there's a few more repercussions for that. But I mean, people do it, right? I mean, we're all adults. We have to work with them what we can work with. So there is a mechanism in place for you to withdraw from courses after the add drop period as well.
Thank you.
You're welcome. Okay, so it looks like Carissa also had a question about how exams are scheduled. Are they self-scheduled so they do not fall on a work day? Not necessarily, Carissa, but they are scheduled across a span of time. So most courses, the exam will open on a certain day and run for about, I'm gonna guess here, 4 to 7 days, and then that exam will close. So that you have an option of a collection of days in which you could take your exam. Does that help? Stacy has a question about how different is the workload between full-time and part-time. It's significant. I'll be honest with you, it's significant. When you're taking 2 courses per term, you're probably going to be studying upwards of 20 hours a week. So if you are taking 1 course a term, then that drops. Thank you, Carissa. That drops considerably. So it can. We do cluster like courses together. So we try to prevent some of that. If you're working on something in one course, we try to make sure that it applies to the other course, like our primary care courses. But yes, I think that taking more than one course does increase the workload. Deborah, I don't think we have a list of courses for this presentation that are in the curriculum. I can run through them relatively quickly. Oh, wait a minute. Richard's got us a program of study here. Did you see the program of study? Do you have any questions about that? We generally,
Oh, sorry.
I was just going to say, we generally start with what we call program core courses. So those are the three Ps: pathophysiology, pharmacology, and physical assessment, along with health promotion and a psychiatric concepts for APRN's course. And then we branch into what we call the management courses. So that's going to be your adult primary care, pediatrics, and women's health. And then we move into clinical courses. So it kind of scaffolds as you move along.
Okay, and it looks like there's a health assessment class as a prerequisite.
That is something, I don't know if Richard can speak to that. That is generally something that is decided upon at admission based on what other health assessment courses you have had. So not everybody takes that course, but is there for those who need to.
Okay, all right, thank you.
You're welcome. And then Angelica says, additionally, for the didactic course, how do you support students virtually? Is everything self-paced? Well, let me stop there and answer that part of your question. No, it's not self-paced. There is a minimum schedule that we would have to keep up with. So for some courses, that means that there might be an exam every 2 weeks, every 3 weeks, something like that, and you have to maintain that schedule. But it's not synchronous. If we do have something synchronous where we all have to be together at same place, same time, learning together, then you have a range of options for when you're going to do that. So the flexibility is there, but we also have enough structure to keep us all moving and getting that experience that we need. So no, you do not have a mandatory online class that you have to take. Every class is recorded so that you can watch it. I encourage you to go to the ones that you can because that engagement helps you learn. But no, there aren't any mandatory courses. Instructors are available at different times in different time zones. Yes. Some of that takes some planning, of course, but yes, you have access to your instructors. Most of them have open office hours and are willing to meet in the evening if they need to meet with their students. All right, and I'm scrolling through here. Does it cost the student to attend on campus? There, for Frontier Bound, I believe it's all just part of the general fees. There is housing and food provided on campus. For Clinical Bound, there is a Clinical Bound fee, and that includes housing, food, technology, all of those sorts of things. Does that help answer your question, Stacy? There are 3 meals a day. There's a fitness center. It's in a cute little town, so you're close to grocery stores and that sort of thing. Christine asks, can you transfer credits for classes that have already been taken? Yes, we can discuss that. We have many students who do transfer credits. There are some rules associated with it and some timelines associated with it, but yes, there is an option for transfer. Thank you. I'm so glad to hear you'll be reaching out. Thank you for putting that policy in there. Thank you, Edward, for saying you'll be reaching out. We look forward to it. Stacy asks if she can bring family. There are some family accommodations. It depends on the reason, and there's certain rules, so we could talk about that. For certain reasons, yes, we do provide housing for family as well. Thank you for your amazing questions. I want to make sure we've answered them all.
I have one more quick one.
Yes.
So who would I call that I could just have like a quick conversation to kind of paint a picture of what it would look like with my scenario? Because for me, the biggest thing is just time,
Mhm.
just definitely want to do this, but I also have a really full plate. So I want to make sure that I'm not biting off more than I can chew. So I kind of wanted to talk to somebody one-on-one and say, okay, this is my plan. What do you think? To give me some direction.
Our admissions counselors are wonderful.
Okay.
So we can make sure that you have access to the admissions counselors. You can save my email if you'd like to talk about it. I'm happy to talk about it.
Okay.
I want you to be as prepared as possible.
Yeah.
So, no smoke and
Yeah.
mirrors here. I'll
Okay.
be, I'll be
Admissions. Okay,
yeah,
just
or the
contact.
admissions counselor for sure.
Okay. Okay. Thank you.
You're welcome. And Stacy has another question. Can you do clinicals at the same company where you're working for? Yes, you can, but you're correct, not in the same department. So if I'm a registered nurse in the emergency room, I cannot do my clinicals as a F&P student in the emergency room in the same physical location. If there is another location that you can go to, then you can do that.
Awesome. Thank you so much.
You're welcome. Well, thank you. You've been an amazing group to talk to. You've made my evening. I love the interaction. If any of us can be of assistance or answer any more questions, please don't hesitate to reach out to us.